Hey guys, Dr. Rob here today, and I wanted to welcome you to another one of my whiteboard sessions where we are going to talk about how to know if you have thyroid brain. And what do I mean by this? I mean your thyroid is behind or the root cause of your brain symptoms, such as maybe anxiety, depression, insomnia, chronic fatigue, inability to focus, inability to concentrate, weepiness, brain fog, so on and so forth. But before we get into that, let's go ahead and if you can, please hit the subscribe button for me, hit the notifications button, so that way you could stay informed and we could get to hang out. All right, let's do this. So it's very important to identify root cause, or at least general cause, because a lot of people can suffer with anxiety or depression and they start to treat nutritionally or they treat with medications pharmacologically, and you're never really getting to the root cause. You're like, hey, let me take more B6, that's supposed to make you feel happier. Let me take some omega fats, that's supposed to make you feel happier. Let me take some Prozac or Zoloft or whatever. But the truth is we got to get to the root. So one of the ways we know if it's the thyroid is if you have some of the thyroid symptoms, like loss of your hair, thinning of your hair, loss of the outer 1/4 of your eyebrow, craving for carbohydrates, weakness in your nails, brittle nails, not a clear definition between your calf and ankles, extra weight here or material underneath your arms, and weight gain all over versus in one place. If you have those symptoms, and you're also suffering from depression or anxiety or lack of focus or something along those lines, it's possible and plausible your brain symptoms are coming from your thyroid. So, okay, how does it work? Well, let me explain how it works, and then I'm going to explain what to do about it. Okay, so I'm going to give you the remedy or solution here. So the way it works is your thyroid gland makes a hormone called T4. T4 travels to the liver and gets converted to T3. Both T4 and T3 are active in the brain. So T4 and T3, they go into the brain. The brain has special receptors in it, one called TR. TR just means thyroid receptor. TR beta 1, don't get crazy about the name. And the other simply called TR, thyroid receptor alpha 1. So alpha 1, beta 1. So TR beta 1, TR alpha 1. The thyroid hormone has to travel and it connects to, it binds like a key fitting into the lock. It fits here and binds to these thyroid receptors in the brain. When that happens, certain parts of the brain that are associated with focus, concentration, a calming of the body, so less anxiety, right? A brightening of the mood, a better ability to process information. Those things start to occur when the thyroid hormone is able to bind with these thyroid receptors in the brain. If there's not enough T4 or T3, you're going to have problems. Now, your hormone levels may be normal, but your brain levels might not be normal. What do I mean by that? It's not just about how much hormone your body's making, it's how active the hormone is in the brain. There's certain things we look at in your blood labs, like you have to look at reverse T3. If your reverse T3 levels are high, you might have normal T4 and T3, but reverse T3 binds to T3 and stops T3 from working. So you can have normal amounts of T3 in the body, but if there's high reverse T3, it kind of messes it up. And there's other factors as well, which I won't get into it. If you have additional questions, please feel free to put them down below. Or if you're watching this on social media, direct message me. I answer almost all my direct messages. And if you need some help, call the office, of course. But let's get through this. So now, what do we do? If we have the thyroid symptoms, you get how this works. The thyroid hormone has to bind with the receptors in the brain. What do we do to help it? Well, the first thing is if we have primary hypothyroidism, so there's no Hashimoto's involved, we don't have elevated TPO, we don't have elevated thyroglobulin, so our antibodies are okay. We then want quality iodine sources. We want things like dulse, nori, wajiki, bladderwhack. We want to use the amino acid, either tyrosine or preferably, if there's problems with focus, concentration, and depression, we want to use N-acetyltyrosine. Now, this is important. Listen up to this one. We don't want to use N-acetyltyrosine if there's anxiety present because it can stimulate the adrenals to produce epinephrine, which is essentially adrenaline. And the last thing a person needs who's really anxious is a shot of adrenaline. So we don't want to give them N-acetyltyrosine if they have anxiety and or elevated cortisol or really any type of significant adrenal issues. We don't want to typically give that unless we have justification for it. So the other things that we want for the thyroid is anti-inflammatory water foods. We look immediately towards things like wild-caught salmon, wild-caught cod, wild-caught shrimp. They're bottom feeders, but if you don't like any of the other fish and you got to go with something, you can go with wild-caught shrimp because that's good for the thyroid as well. Again, if you don't have primary hypothyroid, if you don't have Hashimoto's, then you can go ahead and avoid the cruciferous vegetables or really lessen those. And we want to have foods that are going to elevate an enzyme in our body called superoxide dimutase. What superoxide dimutase is? It's a cleaner. Think about your kids when they're young, if they throw their toys all over the place, and you're coming in and you're picking up after them and picking up after them and picking up after them. Well, your superoxide momutase. No, you're not. Your superoxide dimutase. Okay, you're picking up their stuff, right? You're cleaning up the stuff. That's what SOD, superoxide dimutase, does to the thyroid. It cleans up all the junk that's in it. And what we want to use to elevate that is wheatgrass juice. Peas are also pretty good for that as well. Asparagus can be decent, but wheatgrass juice is a phenomenal thing to help clean your thyroid up. So if you're suffering with those symptoms, these are good things you can do. If you need some help, of course, reach out to us. We probably have a link down below that you can click on and check out more information on the thyroid or get some help or something like that. In any event, thank you guys for being here with me today. If you like that information, please take a minute and hit the like button, and I will catch you at the next whiteboard session. Thanks. Bye.